Nasal airway obstruction is simply the inability to breathe through the nose on one side or the other.
It's very common. Nasal airway obstruction is probably the most common symptom that I, as a rhinologist, will see.
In my patient population, nasal obstruction due to some type of lateral wall insufficiency is very common.
The literature says it's an inordinately high percentage, which I do believe.
Dynamic collapse means that the cartilage is weak, and as someone is taking a breath through their nose, the negative inward forces cause that cartilage to collapse down and close off the valve area.
It certainly happens more as people breathe in, especially as they breathe harder.
Sometimes patients will just tell you, they'll say, "Hey doc, look, when I breathe in deeply, look how I can collapse my nostril."
First, I actually just look at the external nose. When people take a deep breath in, you can see it very, very easily by just watching someone breathe.
Other times you have to sort of investigate it, and the different methods of investigating it are either the caudal maneuver or with the ringed curette performing the modified caudal maneuver, and then asking the patient if that improves their sensation of nasal obstruction.
I'm starting to look for it more and more in my patients, and I'm finding it more frequently as well.
Patients might try breathe right strips, and then surgical options would include batten grafting, alar strut grafting, spreader grafts, relatively invasive procedures.
It's one of the most frustrating things to treat because there's a lot of different options.
Patients will sometimes clearly state the limitations of the surgical options.
The current techniques, the batten grafts, the spreader grafts, change the shape of people's noses. They make them wider.
Most of the patients who are considering nasal valve repair without cosmetic rhinoplasty are looking for a functional outcome rather than a change in the appearance of their nose.
LATERA is an absorbable nasal implant placed under the skin to support lateral nasal wall collapse.
I think the device is excellent at stabilizing nasal wall, not flaring it.
LATERA allows me to repair the nasal valve in a reliable and predictable fashion.
I have found that LATERA has been helpful. It allows you to treat someone who does not want a big surgical procedure.
I have not seen any long-term cosmetic changes.
In all the patients we performed so far, we have before and after photographs, and you can't see a difference.
I have been really pleased that the patients are coming back, they're really happy and feel like my breathing is so much better.
It's actually been very satisfying for me in my practice because I can literally go to the post-op recovery area and patients will say, "I can breathe." It's been very straightforward in terms of recovery. They haven't really had much swelling or bruising in the area. A small amount is fairly typical, and I do warn them about that.
We're looking at our patients 3 months, 6 months, 1 year down the line, and are seeing significant improvement in their breathing through their nose at rest, breathing through their nose at night, and improvement in their breathing when exercising. This is a procedure that provides maximal benefit.